Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron is not with us today.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we are speaking about Congenital Cytomegalovirus. Want me to say that again?
Sure. Say it 5 times fast.
Congenital Cytomegalovirus.
Okay, now say it 5 times fast.
No, I can't.
Patting your head and rubbing your belly. Okay.
To start us out, Jean, first, can you tell our listeners what is cytomegalovirus, and then we can add on the congenital aspect.
Sure. Cytomegalovirus, I can't say it either, or we're just going to call it CMV.
There you go.
Okay. Is a common herpes virus. And when you hear herpes, you probably are thinking more like herpes simplex, but there's over 100 different types of herpes.
I did not know that.
Okay. It's just the form of the virus.
Okay.
It's describing that more than the actual virus,
So the name herpes doesn't mean much. It means a lot.
It means something. It's like saying coronavirus. There's a ton of different coronaviruses. It's based on the appearance of the virus as seen under like an electron microscope.
Okay.
So it's not, yeah.
Got it.
And it may influence how you treat that disease or that virus and things. But when you say herpes, it could mean 100 different things. I mean, it could mean like Epstein-Barr, and it could mean CMV here.
Okay.
So, don't just jump to herpes simplex or, that kind of thing.
Okay.
And once infected, your body retains the virus for life. And most people...
Wait. Can I interrupt you again?
Of course.
Is that true for all herpes viruses? That once you get it, you got it for life? Not sure.
I don't know.
Okay, we'll look that up and we'll put it on the website.
Okay. Because, I don't know.
I'm going to put it on the website.
Okay. I mean, I only took one course in microbiology.
That's
it was
all right.
wonderful, and I did very well, but I did not learn that much. I'm not a virologist. I can't even say it. Okay. Most people don't know that they have CMV. And if you do have it for life, it doesn't mean that it's not in an active form or an active disease.
Okay.
And because, it rarely causes problems in healthy people. But if you happen to be pregnant or if your immune system is weakened, CMV can be a concern.
Okay.
Women who develop an active CMV infection during pregnancy can pass the virus to their babies who might then experience symptoms. And it can be, it's important to be tested. So for people who have a weakened immune system, for example, people that are taking medications after transplant, or people that have, other things that are weakening their immune system, especially people...
HIV?
Yeah, or like people that are getting a stem cell or like a bone marrow transplant,
Sure.
or HIV. CMV infection can actually be fatal.
Okay.
And CMV spreads from one person to another through bodily fluids such as blood, saliva, urine, semen, or breast milk. I don't want to know how people are spreading urine, but okay. There is no cure, but there are medications that can help treat the symptoms, and there is also a vaccine.
Okay. There is?
Mm-hmm.
Okay. So if we add the congenital aspect, rare.org, which is a website that talks about rare diseases, says that it's a group of symptoms that may occur when an infant is infected, the congenital part.
Right.
An infant is infected with the cytomegalovirus before birth. Most infants who are infected with the virus never develop symptoms of the condition. However, approximately 10% of babies will experience health problems and or disabilities. Congenital CMV occurs when a mother is infected with the congenital cytomegalovirus during pregnancy, like you said, and passes the infection to the fetus through the placenta, which is through the blood. CMV is the number one infection that causes birth defects in the U.S.
Right, and I
didn't know that.
I think it's also responsible for the most stillbirths and that kind of thing too. I mean, it's
miscarriages.
Miscarriages, yes. So it's you don't really. I mean, like I had never heard of it before we were in North Carolina, and our cousin was offered an organ, and they said, but just so you know, the person had CMV. So then you, for the rest of your life, will have CMV. And she is a woman, and, they had to take into consideration, is she planning on having children in the future? Is that going to be a concern?
Okay.
Things of that nature.
Okay.
And according to the Mayo Clinic, most babies who have congenital CMV appear healthy at birth. A few babies who have congenital CMV who appear healthy at birth then may actually develop signs over time, and sometimes not for months or years after birth. The most common of these is late occurring signs such as hearing loss, developmental delays. A small number of babies may also develop vision problems. And the following signs and symptoms are more common in babies who have congenital CMV and who are sick at birth. So, for example, premature birth, a low birth weight, yellow skin or eyes, also known as jaundice, an enlarged and poorly functioning liver, purple skin splotches or a rash or possibly both, an abnormally small head, which is microencephaly, an enlarged spleen. They may also have pneumonia or seizures, and CMV will impact the brain in approximately 75% of babies born with congenital CMV, and this may lead to challenges later in life. Conditions that they may face include autism, central vision loss.
Hold on.
What?
Hold on.
Mm-hmm.
Okay, so CMV, I got to go back to my notes here.
Okay.
If they show symptoms at birth, so it's not after birth, because you're saying that some people develop...
It'll take time,
right? But if they have symptoms at birth, then it will impact the brain in 75% of those?
To be quite honest, I didn't write this script.
Okay, I'm just saying. And autism is one of the possible conditions. So I'm just thinking autism. Everybody's blaming
everything
vaccines and other things. I wonder if it's CMV. I've never heard anybody saying, oh, autism, it's CMV. I've never.
Okay.
This is bothering. Okay, go ahead.
Okay.
I'll let you continue.
And you can be tested for it, if you're pregnant, to find out if you have it, and then they give you antibiotics or
such a simple fix. And go ahead.
Okay. Yeah.
Conditions that they may face include?
Include autism, central vision loss, scarring of the retina, swelling and irritation of the eye, cognitive and learning disabilities, epilepsy, impaired vision, problems with physical coordination, and seizures are all possibilities.
Yeah, that's incredible. CMV is related to the viruses that cause chickenpox, herpes simplex, and mononucleosis. CMV may cycle through periods when it lies dormant, like you were saying, and then reactivates. If you're healthy, CMV mainly stays dormant. When the virus is active in your body, you can pass the virus to other people. The virus is spread through bodily fluids, like you were saying, including blood, urine, saliva, breast milk, tears, semen, and vaginal fluids. Casual contact does not transmit CMV. Casual contact is what, like shaking hands?
But we don't do that anymore.
No,
bumping elbows.
Won't do it either.
Nope, staying 6 feet apart.
Right. Okay. Ways that the virus can be transmitted include touching your eyes or the inside of your nose or mouth after coming into contact with the bodily fluids of an infected person. Now, you were saying, like who's sharing urine or something. But if the baby has a wet diaper and you're changing the diaper, and then you don't wash your hands, and then you touch your eyes.
Oh my gosh! Okay,
I'm just saying.
I know
it happens. It happens. So, okay.
I'm very grossed out.
Hey,
it's a boy.
Yeah.
You're changing the diaper.
Oh my gosh, that has happened to me.
And you don't have a little cloth over it. Yep, you can get it shot right in the eye.
That has happened on more than one occasion.
Which is funny because you had 2 girls, so
I had 4 brothers.
Oh, okay. I was going to say,
Or you had a really good aim. Other ways that the virus can transmit is sexual contact with an infected person, the breast milk of an infected mother. Obviously, it would be the child that would get it that way.
And that's when the podcast went off the rails.
Organ, bone, marrow, or stem cell transplantation, or blood infusion. So they don't check? Wait a minute.
They do check, and that's like I was saying.
Oh, so this is in a...
That's what I was saying. Like in Gina's case, she was offered a liver.
Okay.
They said, we have a liver.
Okay.
The person was healthy. The liver, we physically looked at it. The liver looks good, but they
did have
CMV.
Okay, all right. And another way that it can be transmitted is just through birth. And we already talked about that, through the placenta.
And also at birth, I think.
Oh, so like during birth.
Birth is messy.
Yes, it is. The risk of transmitting the virus to your baby is higher if you become infected for the first time during pregnancy. And with those symptoms, will your doctor be able to make a diagnosis, or do you have to go through testing, or do you have to determine cause of your symptoms to find a diagnosis?
I have no idea. Oh, wait. Okay, yes. There are laboratory tests that can be conducted, including tests for of the blood or other bodily fluids.
Okay.
And they can also test tissue samples, and that can detect CMV.
Okay, thank you. And how common is CMV?
It's rather common, and CMV is a virus that's found around the world, and it's related to the virus as we had said, to, you may have heard of a...
chickenpox.
Yeah, I was going to say you may have heard of a herpes-based or herpes virus before, such as chickenpox, mononucleosis. I know, you would think I'd be able to say it, but I cannot speak today.
That's okay.
Epstein-Barr and other conditions are also herpes viruses. And approximately 50% to 80% of adults in the U.S. have had a CMV virus by the age of 40.
Okay, hold on. Between 50 and 80% of adults in the United States have had a CMV infection by the age of 40, and nobody knows about it.
I wouldn't say nobody knows about it. Obviously, they know
I never heard about it.
Okay, so we didn't know about it, but apparently medical personnel know about it, because the only way they would know about it is if they were testing and getting the results.
All right.
But I guess it's like having an HPV infection. A lot of people have an HPV infection
and don't know it. Okay.
And just like an HPV infection, there are vaccines out there. Once, as we had said earlier, once CMV is in a person's body, it's in your body for life. While most people have mild symptoms for up to 2 weeks, there is a subgroup that have recurring bouts of active CMV.
Well, that's not a good group to be in.
No, well,
Okay.
Yeah.
The Mayo Clinic says that symptoms of recurring CMV vary depending on which organs the virus has affected. Areas likely to be affected are the eyes, the lungs, or the digestive system. Symptoms may include fever, diarrhea, or other gastrointestinal ulcerations and gastrointestinal bleeding, shortness of breath, pneumonia with hypoxemia, low blood oxygen.
Okay.
Let's just say low blood oxygen. Mouth ulcers that can be large. So that's like a canker sore?
Well, it's not a canker sore, but a mouth ulceration.
Different? Okay. Problems with your vision, including floaters, blind spots, and blurred vision. Hepatitis or inflamed liver with prolonged fever. Encephalitis, this is a bad one, or inflammation of the brain, leading to behavioral changes, seizures, and even coma. So that's the worst, huh?
It all sounds pretty bad.
Yeah, but, the initial infection can resemble mononucleosis and include a fever, feeling flu-like, swollen lymph glands, headache, an enlarged spleen. Of course, who checks for an enlarged spleen?
Well, I'm thinking you would feel uncomfortable because you have swelling.
Oh, okay. However, most people never realize that they've acquired the virus because they'll have minimal or no reaction at all. After the initial infection, CMV remains dormant in fibroblasts. Well, that's a fun word. And other immune cells of the spleen, liver, and other tissues in the body, unless immune function falters. And then there's an opportunity to reactivate. The viral reactivation symptoms are similar to those of Epstein-Barr, like you were talking about. Epstein-Barr is also abbreviated as EBV, and primarily include fatigue and feeling flu-like. Like EBV, chronic CMV typically does not respond to antiviral drug therapy. The greatest concern with CMV is its association with cardiovascular illness, where it's relatively uncommon. A study published in the Journal of the American Heart Association suggested that cardiovascular disease attributed to CMV could be as high as 13.4%, but studies are continuing.
That'll be interesting. We'll have to keep an eye on that.
All right, I'll make a note.
Yeah, because it would, then more. I guess you would be tested for that more often, as just maybe your annual test, your annual physical,
Sure.
and then take steps to. Yep. Okay.
I wonder if that's just the inflammation of the arteries and the blood vessels.
I don't know. We'll have to read up on it and then put more links on our website.
Gives me something to do.
Okay, in your free time while you're sleeping.
I also read an article on the website Transplantation, which I didn't even know there was such
I didn't either. We had to put a link for that too.
I already did.
That sounds like something fun to read in your free time.
It is. And it's a great information source of scholarly articles concerning organ transplants.
Okay.
If I would have known that was available when Gina got her
Right,
transplant,
we would have been reading it
I would have
every
been
day.
all over it.
Oh, yeah.
The article dated June 2017 said cytomegalovirus is one of the most common opportunistic infections after a solid organ transplantation.
Okay, so if you had CMV and
Yes.
it's laying dormant,
Yes.
and now you're taking immunosuppressant medications because you just had
Okay.
an organ transplant, then it can reactivate. I
Okay.
can see that. Okay.
CMV commonly presents as a viral syndrome, characterized by fever, malaise. I don't know what that is.
Leukopenia.
What is leukopenia?
I'm thinking it affects
Okay,
your
hold
leukocytes.
on. We got a plane.
Okay. We can also do a quick Google search. Okay.
Okay.
Mhm.
And it can cause tissue invasive disease such as colitis, pneumonitis, and hepatitis, which is against your liver. So
Inflammation of the liver.
Yeah, terrible. So, Jean, how is CMV treated?
No idea.
Why do I ask you?
Oh, okay. So scientists have been searching for a CMV vaccine, and I know that there have been vaccinations out there, but there is no cure. There's
Okay.
no way to, be permanently cured.
Okay.
People with acquired CMV who contract the virus for the first time can use over-the-counter pain relief medications like Tylenol, acetaminophen, ibuprofen, or aspirin, whichever is safe for you to use, and you can ask your healthcare provider which you can use to relieve the symptoms. You also want to make sure that you're hydrated and drinking plenty of fluids. And then people with congenital or recurring CMV can see their healthcare provider about antiviral medications to slow the virus's spread. So that's an option too.
Okay.
And then these medications have some, adverse effects. If there's extensive organ damage, hospitalization might be necessary, and newborns may need to stay in the hospital until their organ function returns to a normal baseline.
Okay.
And actually, the CDC suggests that prevention is the best thing to do since there is no cure.
Okay.
The following precautions may help lower your risk of contracting CMV. Wash your hands regularly with soap and water. Can't say that enough about a lot of things. Avoid kissing a young child, and prevent tear and saliva contact. Avoid sharing glasses and kitchen utensils, such as passing around a drink. I know I was watching a TV show where they were passing around a bottle, and in this post-COVID world, I was like floored.
Yeah.
I was like, oh, that would never happen.
Nope.
But it's probably a good idea not to do that ever, because you can spread all sorts of things. Dispose of diapers, paper handkerchiefs with your tears and other fluids, and similar items carefully. Use a condom to prevent the spread of CMV during sexual intercourse. The CDC urges parents and caregivers of children with CMV to seek treatment as early as possible, whether it is taking medication or attending all the appointments or services and that kind of thing. And then you also want to have hearing checks because it affects your hearing.
Right. Okay. I wonder if the numbers have gone down due to COVID, because daycares have been closed, schools have been closed, and people have been taught to wash their hands.
Well, hopefully.
To prevent disease transmission.
Right.
I mean, hand washing should have been a common sense thing, but maybe humans do need to wake up and get serious about their health type event in order to keep things back in balance.
And I guess, you really don't think about it. When you're in school, you're teaching, or you're caring for young children at a daycare center, when you're having them blow their little noses and everything kind of gets everywhere, you think about spreading colds,
right,
which is a virus, but you don't really think about CMV and other viruses. But yeah, good hand washing procedure and technique is vital for everyone, I guess. So according to the CDC, approximately 1 in every 200 babies is born with CMV. So most of these infants will have no signs or symptoms at birth, but around 20% of them will have symptoms or long-term health complications, including learning difficulties. Symptoms may be severe, and they may include vision and hearing loss, like we said before, small head size, weakness, difficulty using different muscular systems and coordination, possibly seizures, and one child is permanently disabled by CMV every hour here in the U.S. So that's a lot.
That seems like a lot.
It does seem like a lot.
Yeah.
Yeah. And so for something you really don't hear about, that's why I guess they have things like
PodcastDX.
No, I was thinking more like Cytomegalovirus Awareness Month.
Oh, yes.
Which is why we're doing this.
Oh, good timing. Okay. Did you know that CMV was confirmed as one of the causes of the most salivary gland cancers?
The most common salivary gland cancer.
The most common Okay, let me start that over.
Sure.
And did you know
Nope.
that cytomegalovirus was confirmed as one of the causes of most common salivary gland cancers?
I didn't.
Well, now you do.
Okay.
The study was conducted by USC Laboratory for Developmental Genetics, and it isolated less than 10 oncoviruses. I never knew what oncoviruses.
Well, if you think about oncology, is the study of cancer.
Okay. So those are viruses that cause cancer. And what advice do you have for someone recently diagnosed with a congenital cytomegalovirus?
Well, since they're a baby, for their parents, I would say that since it's so prevalent, the National CMV Foundation is a good place to go, and they suggest really, trying to prevent the spread of it from, going further. So contact with saliva, like we said, urine of young children is a major cause of CMV infection among pregnant women. So say you're caring for someone else's baby, and especially mothers, daycare workers, preschool teachers, therapists, nurses, people that would, have contact on a regular basis with potentially, bodily fluids. Women who are pregnant or planning to become pregnant should practice the following CMV prevention and healthy pregnancy tips to help mitigate the risk of contracting CMV.
Okay.
Do not share food, utensils, drinks, or straws. Okay. Saliva may remain on food, cups, cutlery, and it could transfer the CMV infection to you and your unborn child. So although it may seem easier to feed your child from your own plate, or like you're feeding like a little toddler or someone, you don't want to waste the remaining food on your child's plate. You might eat that food. Don't do it, and don't share food or cutlery. Okay. Do not put a pacifier in your mouth to clean it before giving it back to your child.
Always do that.
That's so gross.
Okay.
Yeah. Okay. And how many of us are, not me, but how many of us are guilty of wanting to clean our child's pacifier by putting it in our mouth, or your hands are full and you put the pacifier in your mouth just to hold on to it for a moment. So gross. Saliva on your child's pacifier may transfer CMV to, like if they have CMV, it could give it to you. If you have CMV, you could give it to them. And try to get in the habit of putting a pacifier on your pinky, not in your mouth, or in a case. Skip the pacifier.
In a baggie?
In a baggie somewhere. Avoid contact with saliva when kissing a child. Do not kiss a child under 6 years of age on the lips or the cheek to avoid contact with saliva. Instead, kiss them on the forehead or the top of the head and give them a hug. Nowadays, don't do any of those things.
Right.
Never share a toothbrush. So gross. Toddlers love to imitate everything you do, including pretending to brush their teeth with your toothbrush. So store your toothbrush in an area that your child cannot reach, because they also could be brushing the dog with that thing. They could be cleaning the floor with that thing.
The toilet.
Okay. And wash your hands. We can't say it enough. Wash your hands often with soap and water for 15 to 20 seconds. Sing a little song while you wash to, make sure you're getting taking enough time, especially after the following activities: wiping your young child's nose or a young child's nose or drool, changing diapers, feeding your child, anything that, might involve saliva, or even handling children's toys, because they, infants tend to put everything in their mouth. And then
so you're at a daycare.
Yeah.
Everybody's putting everything in their mouth.
It is just like a virus factory.
What the heck, right?
Well, I guess if you have, remember when we saw that person working at the hospital and they were like in a little portable cubicle? It had like okay, never mind.
Okay.
I was going to say, because I kept saying, that's the future of daycare.
Oh, yeah. It was like a bubble.
It was like a bubble, like a little rolling bubble.
Right.
Yeah, but
you know what? Kids, you're not going to have that.
No, and that's why kids get sick a lot when they're little, because they're playing with other kids and,
handling toys, and everybody puts it in their mouth.
Yep.
All right.
It happens.
Well, good to know. All right. Well, I think that wraps it up.
I have more questions than I had when we started.
Yeah, me too.
Yeah, because it's not something we ever hear about.
No. If you have any questions or comments related to today's show, please
keep them
out.
To yourself. Oh.
Reach out to us at PodcastDX@yahoo.com. That's our email.
Oh, okay.
We also have a website, PodcastDX.com. We're on Facebook, Twitter, Pinterest, and Instagram, all under the same name.
Okay. And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.